This year's flu season was long and tough. The Center for Disease Control and Prevention labeled it a moderately severe flu year. EMS Medical Director for the Houston Fire Department and Public Health Authority for Houston Public Health and Human Services, Dr. David Persse, said the reason is the flu got a jump start, with cases being reported in November, a month earlier than usual.
This year, the 2012-2013 flu season, it did what we call it came in two waves. And so the first wave came in November, and then throughout December, it looked like things were settling down. And then come again January, it spiked again. In fact, in January, it spiked even higher than it had in November.
The virus circulating this year has been particularly harsh on the elderly. The CDC reports half of the patients being hospitalized for the flu are 65 or older.
The one thing that we saw this year, well, actually, I shouldn't say we saw it like it was different, but the one thing we were able to better measure this year than we have in the past and confirmed our suspicion is that the flu vaccine doesn't work as well as we had hoped that it would in the very elderly. And we've always suspected that that was an issue because as we get older, our immune system becomes less robust and it weakens, just like the rest of our bodies weaken.
Flu season can be extremely difficult for children as well, with 110 pediatric deaths being reported this year, which is the yearly average for influenza. Pediatrician at UTHealth and Children's Memorial Hermann Hospital, Dr. Galit Holzmann, says the virus can be potentially serious in children and should always want to try and prevent it.
Getting the flu always can be dangerous in certain children, and I believe the latest statistics in Texas were that there were 14 pediatric-related deaths due to the flu. And oftentimes it can be that children who get the flu are more susceptible to getting bacterial pneumonias, and they can become quite sick.
Both Dr. Persse and Dr. Holzmann agree that the best way to arm yourself during flu season is to get vaccinated and practice good hygiene.
Anybody over 6 months of age should get the flu vaccine. Staying home when you're sick, washing your hands, covering your cough, all of those things are important in preventing spread.
As the flu season winds down, experts say it can still make people sick well into May. And the best way to prepare for the next flu season is by getting the flu shot early in September or October before the season begins in the U.S. For College Smart, I'm Priscilla Riojas.